Daddy Squared. Gay Dad Saved the World.
A daily dose of gay dads on the front lines of the global pandemic.
With Alex McGann and Jan Dick.
Hello, everybody. Welcome to day 12 of Gay Dad Save the World. Alex, I think it's about time that you're going to talk about your junk food, because you're enjoying shaming everybody with their junk food. But I want people to understand what you're going through with your food, which for me, it was, for lunch, I remember that I ate a quarter of a cake.
Yeah.
And then for dessert, I had cookies.
Yeah. Look, so I was fat as a child. Truly fat as a child, and I have been working hard my entire life to keep off the weight that I lost after I came out when I was like 23 or something like that, and largely successful. Let's just say that the pandemic has not been good for that effort. There are Duncan Hines brownies, there are cookies, there is, it's mostly like confections that I go for. And that coupled with the fact that, we feed the kids, chicken nuggets and French fries and crap like that. And that's basically what I eat, is what they are eating. It's bad. This is a bad time for both keeping weight off and also for remaining healthy. And I'm a little worried about it.
It's pandemic pancake panic.
Ooh, pandemic pancake panic.
It's P3.
I like it.
Yes, I do that too. I was never fat as a kid, but I do work out until the pandemic started and they closed the gym and I became depressed.
Yeah.
And I don't do that at home. It's hard for me to actually find the right way to do it. We tried to do the bike and it broke.
We did. We broke our new stationary bike.
We talked about that.
Look, I'll tell you, we've been interviewing all these wonderful people, and we've been hearing the stories of what they're doing in their personal lives at home, outside of work too. And I'll be honest, I feel a little bit ashamed of the way so many of these guys are doing what they're doing, as we're saying, on the front lines of the pandemic. And then they're coming home and they're actually more or less behaving themselves about what they eat and about staying active. And I'm not. I feel as if I've sort of given in to the isolation and the lockdown of this thing and said, oh, fuck it, what's the point? That's not healthy, but it does feel, it feels like what I've been doing.
The good news is that when we're back from the lockdown, we're going to do the transformation, which is very exciting.
Yeah.
By the way, I have to say, out of all of the people who gave us their shame meal, I think the best one so far is the fried dough.
Ah, yes, the deep fried dough.
Yeah.
Yeah, yes, I agree. Because look, when you can't be bothered to even prepare a full recipe and you just say, well, to hell with it, I'll make some dough and fry it. Yeah, I'm impressed with that.
It's John Cunningham.
Well done, John.
Today we're calling Georgia. Chad, he's an internal medicine physician and a COVID team member in his hospital. We're going to talk about what does it mean, actually.
It's not the Daddy Squared podcast unless I make fun of my husband every now and then with his accent.
What did I say wrong now?
You say COVID when everybody else pronounce it COVID.
COVID.
Oh,
okay.
Magnificent.
Thank you.
It's all right to be a foreigner.
All right, Chad. By the way, Chad is my favorite name in the whole world.
It's true. This is true, by the way. I
would
can
have called
attest.
my kid Chad.
If I had allowed it, which I would not have ever allowed.
Yeah.
because look, as much as Chad is a very impressive person from the interview and all that.
Chad.
I have to say that when a person's name is Chad, he has to be wearing a Lacoste shirt and have flippy hair and all right.
Dreamy. All right. All right, Chad, let's talk to you. Let's call you.
Hi, Alex. How are you?
All
We're
right.
good.
Where are you located?
I'm in Savannah, Georgia. We recently relocated from Washington, D.C. about 10 months ago.
Got it.
Which one you think is better for gay dads?
I feel like you can't get more liberal than DC, except for
Right.
maybe like San Francisco. But Savannah actually is a pretty nice hub for the queer community because of the Savannah College of Art and Design.
Right.
So I think within Savannah proper, there's a lot of acceptance, but I definitely have had my share of sideways glances and things like that from some of the people who come from more conservative communities right outside of Savannah.
And you're sure they're not hitting on you? It's a negative kind of sideways glance. I'm just checking. I also understand that your governor is now advocating that people go out and lick each other's faces or whatever that's about.
That's true, as long as you follow it up with a Lysol chaser.
Hey, Chad, can you please tell us a little bit about what your career is and how it's changed as a result of this pandemic?
Yeah, so I'm an internal medicine physician working at one of the hospitals down here. I spend part of my time in the hospital and part of my time in the clinic setting, and I actually do a lot of teaching for one of the local universities. And as a result of this pandemic, we did kind of shift around our schedules temporarily just to kind of minimize exposure of our residents and faculty to the virus. And then clinically, we usually, when I work with residents, they'll go in and see the patients, and then I'll go in and see the patient. And so if there's anyone we suspect might have COVID or the coronavirus, I will just see them by myself, because I figure if I have to see them anyway, what's the sense of exposing them unnecessarily?
Have you had a significantly, it's not a particular hot spot, Savannah, I don't think, but it certainly is enough of a center that it's got to have some, right?
Yeah, we because we're a bigger medical center, we do pull from some outside communities. So we get some people who have been transferred from other areas. And I do think that we are fortunate in that our mayor, before even Kemp acknowledged that we should close down the state, started doing it with the city. So I think we got ahead of it. And I think a lot of the local businesses are actually trying to stay closed until it's a little bit more out of the window.
What are you doing at the end of the day when you go home? Are you doing a Silkwood shower on the front lawn? What?
So I do. So usually when I go to work, I wear scrubs and I wear gym clothes underneath, so that I actually switch out of my scrubs and just wear the gym clothes underneath in the car. And then I get into the garage, strip down naked, throw all my stuff in the washer, and then shower right away.
So I have a question regarding the structure of the hospital in times like this. Is there a team that treats only COVID patients and the others like treating other patients, or is like everybody's treating everything?
So we tried that a little bit because usually we have 5 teams on our teaching service, and we actually went down to 4. And initially, we only had my team covering the COVID patients, but because the volume increased, we had to expand it. But we do have a few providers who are at higher risk of more serious illness, and so we try not to let those people see the patients who are suspected to have it.
Got it. Well, so can you tell us a little bit about what you have at home in terms of your family and how you got them? Yeah,
of course. Well, I snagged my husband at work. I was a medical resident, and he was my attending. So very Grey's Anatomy, I guess.
Oh, my attending. Jan, I'm going to refer to you as my attending from now on. Anytime. Go ahead.
And so we got married about 5 years ago almost, and pretty much right away we decided that we wanted to initiate the process with surrogacy, and did a lot of research and signed up soon after we got married with an agency that helped us locate a surrogate. But it took a really long time. It was like, I think at least 2 years before we finally got matched with someone. But luckily, I mean, it was worth the wait because we instantly clicked with Liz and Jeff, who are our surrogate and her husband, and they have two of their own kids that are great. So we went through the process and had a successful first run. I know a lot of people have struggled with transfers and things, but we were lucky in that we got pregnant with the first try, and that's how we got Diana, who's just turned 2 last week.
Oh, wow. Diana, by the way, is an incredibly awesome name. If you ask me, I love the name
Wonder
Diana.
Woman.
Yeah, it's kind of Wonder Woman.
Yeah, exactly. So I was really into mythology, and I was trying to figure out names that wouldn't be too weird. And so I really like Diana because it's the kind of Roman version of Artemis, who's the goddess of the hunt and nature.
Right.
And so that's why I chose that name. And then Ray was like, oh yeah, Wonder Woman.
Right.
And then interestingly, I actually was on the treadmill at my gym in DC when we still lived there. And on the treadmill next to me got Gal Gadot.
Yeah. Yeah.
And I was like, oh my God. And
She does exercise amazingly.
That we named our daughter after her. She was really sweet about it.
Oh, that's great. So, what we love to know is, how you have one kid, Diana?
We do, yeah.
And how old is she now?
2.
So, I guess at 2, I'd love to know how the two of you are handling her in this lockdown period.
It's a lot of following her around to do whatever she wants to do.
Right.
I think we're lucky enough in that she doesn't really have social needs. Like, I think a lot of people with older children are trying to figure out how to keep their kids engaged with their peers, but Diana's pretty content in just kind of playing with us. So that makes it nice, but it's also difficult because she isn't really into independent play yet. So it's very difficult to get a lot done when you're home with her. So a lot of my teaching and things I would have to do during nap time. And one time I was giving a lecture and she decided that would be a great time to learn how to take off her diaper in the middle of the nap. So I had to clean that up. But I think we've been managing as best we can. The nice thing too is we actually relocated to Savannah because that's where Liz and Jeff live, our surrogate and her husband. And we became so close with them through the whole process that we decided that we wanted to actually raise Diana with them more heavily involved. So
that's amazing.
A lot of times if we need help, we'll have them watch Diana, and we do the same thing with their kids.
So that means that you guys, I've wondered if there's a term for this. You guys have sort of like connected your social distancing situation with the other family, right? So you guys go back and forth to each other's homes. Yeah,
we do. And I feel it's like mostly out of necessity because we wouldn't be able to take care of Diana in some situations and her daycare's closed. So we have just kind of expanded our family definition to physical addresses, I guess.
Right. Well, there's a part of me that feels like, again, it has to be based on a pretty hefty amount of trust, but these tiny little standalone families like ours, it's real hard for people in a house and nobody else involved for 6 weeks now. It runs up against a limit,
Yeah.
Can you share with us any of the kind of the positive things that have come out of this experience for you over the last weeks?
I would say that I've been having a really fun time of actually getting to spend, the day with Diana, because usually it would be, picking her up and then getting her ready for dinner and bath time and playing a little bit and then time for bed. But I've been able to really bond with her more, which is wonderful. And then we've actually, I guess, our city has actually canceled recycling pickup through this process to minimize the amount of people who need to go out and be exposed. And so we've been working on some upcycling projects. Right now, I am turning a bunch of cardboard boxes into a vanity for her.
That's great.
Yeah, but I think it's also nice because you just start to realize like what at the end of the day is like the most essential part of your life, and you don't need to go out to dinner or to the movies and things like that. What you really need is just your family and your health to be happy.
Right. Well, thank you. And before we finish, I do want to ask a question that is, far and away more important than all of the other ones. And I would ask you to dig deep into your heart when you answer this question. It is
briefs.
Over the last week or two, can you divulge to us the most shameful and embarrassing thing you have eaten?
Ooh.
Yes.
So that's a daily occurrence. I have like a major candy problem.
Can you be more explicit, please?
Alex
What's
is
that?
looking for ideas.
Oh, can you please be more explicit? I need details.
Oh, I mean, I have like I eat very well and I try to exercise every day. I've been doing a lot of YouTube videos and running and stuff like that. Closed. And then I eat, good breakfast and lunch and dinner. And then as soon as Diana's down for bed, I get out the sweet tarts.
Sweet tarts? You're bringing
and eat
sweet
way
tarts
more
to me?
than I should.
Oh, sir, we
Yeah,
are going to have to
shameful.
discuss what shameful is, because sweet tarts is to me like a healthy snack. But okay, fine.
Chad.
We also did discover that our favorite taco restaurant does takeout, and we have been doing that to support local business.
Right.
And you can actually get a gallon of margaritas.
Oh,
Now
They give it to you in what looks like a milk jug.
that's interesting.
And you can bring it home. Yeah. And they're
Now
very
you've-
strong. So we have polished off a couple of those too.
yes, you have finally arrived where I was trying to go. The gallon of margaritas works for me. Chad, thank you
Thank
so
you.
much for taking the time
Yeah, no
to talk to
problem.
us and for what you do. And we do love the idea of a naked doctors in the garage
Oh, yeah.
calendar, which we're going to talk to you about later on.
Okay, perfect. Sign me up.
All right.
Bye-bye, Chad.
Bye.
All right, bye.
That is squared.